The FDA has approved the first ever pill to help treat postpartum depression. It is a serious mental illness which can develop in new mothers after childbirth. The pill is called Zurzuvae. It is a once-a-day pill taken over a course of 14 days. And joining us to talk about the details surrounding this medication is Dr. Leena Mitall, a psychiatrist at Brigham and Women's Hospital in Boston. Thank you so much for joining us. How significant is this new development?
This medication could really have the chance to be a game changer in the way we address postpartum depression because of its unique biological mechanism and the mechanism of its predecessor, brexanolone, as well.
Now, we've seen recent cases where mothers who experience postpartum depression after childbirth, and we see cases either in our own lives or horrific cases that make the news. How do you explain how it affects new mothers in general?
Perinatal depression, and I say perinatal specifically because it can have its onset during pregnancy as well as postpartum, is really a pervasive set of conditions and symptoms that can happen in about 1 in 7 birthing individuals. We see it more often in those who have a history of prior depression, anxiety, or trauma. We see it increasingly in individuals who have psychosocial distress or challenges, individuals who experience racism. And so we are increasingly seeing this greater attention as we're paying more attention to behavioral health and mental health conditions in perinatal individuals. But it's really multifactorial. There are biological, psychosocial factors and personal history factors that can impact its commonality.
For this medication, what does this pill specifically target? What does it alter about a patient's chemical makeup?
So this medication in particular is a neuroactive steroid that has the ability to impact neurotransmitters called GABA, which can have significant changes in the way that they are produced and expressed in perinatal individuals, especially because changes in hormonal levels can abruptly change the functioning of this system of neurotransmission.
Yeah. There is a school of thought now, though, that, there seems to be a pill for everything. And so some people hesitate at this point. They don't want to be overprescribed. What advice would you give to patients who probably need the pill, but might be a little bit discouraged or wary of taking it?
I think it's really important to emphasize that postpartum depression and perinatal depression and all emotional complications surrounding the perinatal period really do have a whole continuity or spectrum of treatment options. Medications are really part of a continuity of treatment options. So we have longstanding evidence around certain types of medications, antidepressants like SSRI medications. This is a new tool in our toolbox, but we also have non-medication options, group support, individual therapy, psychosocial supports, and exercise, self-care, peer support. All of those things have great evidence base and can be pieced together individually based on what works for a particular individual, family, and family unit.
So you think this would be part of a whole mosaic of treatment, and how early do you think doctors might be able to prescribe it for patients?
Well, there's still some things left to be seen. We need to see the DEA schedule this medication so we can clarify what the prescribing practices will be, what the monitoring will be, where it will fit in our algorithms in terms of thinking about how do we select the best criteria for targeting appropriate patients and conditions and circumstances. And so we really need to kind of yet see how this will all play out and how soon it'll be available in terms of supply, as well as in terms of creating sort of safety patterns and monitoring as well.
Yeah, if it can help moms who are really in crisis, it would be well worth it. Well, Dr. Leena Mitall from Brigham and Women's Hospital, thanks so much for taking the time to speak with us. We appreciate it.
Thank you for having me.